So this is a chronic illness.
Yeah.
And it requires some lifestyle changes, I would think, on a patient's part. Could you talk a little bit about that?
Absolutely. So, in addition to the airway clearance and the antibiotics, if a patient is on them, we recommend daily exercise. Exercise is a great way to help with airway clearance, a healthy, balanced diet, and of course, we recommend that patients don't smoke if they are smoking. But since this is very common, this bacteria is very common in the environment, we recommend lifestyle changes that involve the environment. So that may mean increasing their hot water heaters to higher temperatures, to 130 degrees, to kill the bacteria more efficiently. It may involve reducing the number of showers they take. It may involve changing their shower heads so that they use ones with larger holes so there's less aerosolization of the water. We recommend changing your water filters based on the manufacturer's instructions. We recommend avoiding humidifiers if at all possible. And we often recommend boiling water for more than 20 minutes and then using that water to drink in order to kill any mycobacterium that will be in the water. So there are a number of things that we recommend that patients do on a daily basis.
Daryl, tell us a little bit about the changes you've made in your lifestyles and how this NTM lung disease has affected your life.
Okay, well, I've made several changes. And after following with my pulmonologist, they implemented treatment plans to better manage my symptoms. And these, like Dr. Driesel-Harris said, include airway clearance and not, excuse me, medications, and soon to start some cardiopulmonary rehab. The other lifestyle changes I've made are diet, as Dr. Driesel-Harris mentioned. I try to follow a well-planned diet and avoid certain foods that they restrict on and avoid certain foods and liquids. I carry my own bottled water wherever I go. I try not to, even to restaurants. I cook with purified water. I also eat my largest meal earlier in the evening and try not to lie down after it. I also sleep with the head of my bed elevated. I do, as Dr. Driesel-Harris said, take shorter showers. I shower every other day. And I've now switched to washing my hair in the sink instead of the shower because, as she has mentioned, the bacteria can be found in shower heads. When I do very little gardening, but if I do work outside with some plants and flowers, I wear a mask and I try to make sure that the soil is moist so I don't inhale any of the dust from the dry soil.